ophthalmology, renal, adult diabetes, pregnancy, neurology. There's more. I just can't remember it right now. The students are all assigned to an adult medicine team, which there are 4 different teams. So they become part of that team, and a time during their rotation, they will present an in-service to the team on a topic of the team's choice. All the students have to present case presentations, which also do involve journal clubs. One of our primary clinics is a geriatric diabetes clinic. So we see primarily patients over 70, although sometimes they see even 65 and older. There are opportunities for electives in almost any of the areas with shadow experiences, including research. One thing I really like about the rotation opportunities there are their intensive outpatient treatment programs. We have 2 that are, one is 4 days long, where patients come in for diabetes management, whether it's type 1 or type 2. Unlike a lot of settings, about 40% of my patients actually have type 1 diabetes. So I see a little different patient population than most pharmacists do. So whether it's type 1 or type 2 diabetes, they come into this program and they're with us for 4 days, all day long. And usually a pharmacy student is actually assigned to follow one of those patients. The other outpatient program, intensive outpatient program we have is a week-long program. It's actually for weight management and diabetes. And again, the student is assigned to a single patient and they follow the patient throughout the entire week. My students that are on site right now just followed 12 type 1 diabetics through their week and saw the changes that we literally made every single day to watching them. They ate breakfast and lunch with the patients and with the dietitian, so they saw what these patients really have to go through. So I'll stick around if anybody has any questions. If you like diabetes, it does, well, if you don't like diabetes, it wouldn't be a rotation. But if you like variety and you want to learn something, it is a lot of work. Ask my seminar students, it's a lot of work. And I do have high expectations, but you do come out really learning something. Who's next? Okay.
Hello everyone, I'm Dr. Kostka-Rokosz. Welcome. My rotation is an elective drug information rotation, and you don't have to go far. As a matter of fact, you walk out this door, you take a right, and you are there. So, my rotation is with actually Dr. Dvorkin-Camiel, okay, who you know from OTC, and I do drug information, and she does natural products, okay? Our students on rotation in the center answer questions from a variety of individuals who call us, patients, healthcare providers in the area, faculty, etc. Okay? So usually our phone calls, we get phone calls in or we get emails and we answer those questions. In addition, you also go to class with us. So when I teach drug lit, which most of all of you took, right? Some with me, some with Dr. McCluskey, you would go to those classes. You also have an opportunity to go to Dr. Dvorkin-Camiel's herbal class that she teaches right now in the spring. In addition, you might be under the impression that since I teach drug lit, all you're going to do is journal club. Not true. You will do journal club just like every other rotation. Okay? So please do not be under the impression that you're never going to do it again, right? A number of us have already talked about it, but you will do some journal club. You will do a journal scan. There's an oral presentation as well. You do some writing. Okay, so writing in the form of drug information questions, which most people, most preceptors have you do as well. An oral presentation, as I mentioned also. And the other exciting thing that our students have been doing now is we actually have 2 Facebook pages, believe it or not, for the center. One called Medication Health News, plug for Medication Health News. But basically, that is a Facebook page for pharmacy as well as medical news. And my 6th-year students are the bloggers. Okay, so the 6th-year students actually post a blog every single day. They choose the blog, they write the blog, they post the blog, and then they look for comments from people. We also have a blog specifically for natural products as well, and obviously those posts would be in regards to natural products and herbs. So again, it's an elective drug information rotation, and if you are interested in learning a lot about how to research answers to questions, etc., using the databases to the best availability, you can pick our rotation. Thanks.
Okay, good afternoon, everyone. Segal, Bhatt. I have a practice in acute care cardiology. It counts as general medicine or patient medicine experience. I'm at the Memphis Dvorkin-Camiel Medical Center with West Campus, so if you live close by, it's really easy to get to. There is no parking, right? There is parking, but it's again about $40 a day, so a car is not a good option. So my colleagues actually did a pretty good job of describing my rotation. Dr. Chang mentioned the Brigham, and our rotations in our hospitals are actually very similar. So I round with an adult cardiovascular medicine team. So we see some heart failure patients, but we have a little bit more of a diverse setting. We're general cardiology, so you'll get the gamut of acute coronary syndromes, atrial fibrillation, valvular disorders, ventricular fibrillation, along with just general management of other cardiovascular diseases like hypertension, hyperlipidemia, antiplatelet therapy, etc. So that pretty much encounters the majority of inpatient care experience. The word journal club has been a buzzword, I guess, this afternoon. And yes, we will probably end up doing some form of journal clubs on my rotation. It's cardiology, you can't avoid it. Everything in cardiology is a clinical trial, so if you are interested in diving into how to not only interpret data, but how to apply it to patients, a rotation that has some sort of cardiovascular component to me is actually a pretty good one to pick because, like I said, everything in cardiology is a clinical trial one way or another. The other opportunities for the students are to, there's also a lot of other pharmacists and residents at our institution that also serve as preceptors. So much like the Brigham, we also have a lot of other students, not only from MCE, but also from Northeastern. So there's a lot of abilities to share information and work with other students from other rotations. We also have a pretty active residency program, and so whenever the residents do their presenting, which you can imagine is quite often during the course of a particular rotation, it's open for everybody who is at these sites, so the students are exposed to a lot of different resident level teaching and resident level work. So if that is of interest to you, I think that the rotation that we offer will be a pretty good fit. I think I can stop here close to time, but I am able to stick around for questions. So if you have questions about my rotation,